The state budget cuts will affect several programs in the Tulsa area, including the community response team that helps people who have mental health issues. News on 6's Taylor Newcomb is on that story for us this evening. Taylor?
Lori, the CRT consists of a police officer, a therapist, and a paramedic who all respond to a scene at the same time if there's a mental health crisis. A police officer, a therapist, and a firefighter paramedic. These are the resources that could be available on every mental health call in Tulsa.
A lot of times, police calls have a mental health component and or some kind of medical component. So by having all those resources in the car, we're able to kind of deal with whatever comes our way.
But if the state's budget cuts to the Department of Mental Health stand, the community response team may never fully come to fruition.
We are the first people on scene when someone calls 911 for a family member who may be suicidal.
Rachel Dicon says a 30-day pilot in August showed just how necessary the CRT is.
During that time, 67 police officers were released from the calls that we responded to. And that's when we were like, wow, there really is a need for this.
That means patrol officers can focus more on crime, letting the CRT focus on mental health. But without the funds, the team will cease to exist. And Dicon says the repercussions could be deadly.
I have two fears. One is that our suicide rates and our homicide rates are going to get very, very high. My other concern is that people will go to the hospital when that's not what they need.
It would definitely be a step backwards and detrimental to the mental health community as a whole, as far as the people in those professions and the people they serve.
Dicon says they need legislators to find a resolution and fast. If that does happen, they say they do hope to have the CRT up and running full time by the beginning of next year. Reporting live on the scene on the story in Tulsa, Taylor Newcomb, News on 6.